Looking at my personal observations, working for several years with oncolytic viruses, I see a lot of potential in this type of therapy. I have seen that in terms of early stage cancers, oncolytic viruses can be very beneficial to help to sustain this good effect of primary care, such as radical surgery, because we all know that cancers tend to relapse, they tend to come back after some while. So this is where this immune modulation done by oncolytic viruses can be very helpful. And this is how we try to limit all the risks of further spread or relapse of the cancer, yes, in terms of several years ahead. If you look at more advanced cases, I have quite a lot of them in my practice, probably more compared to early stage patients. And here again, we see that oncolytic virus therapy is very good in combination with many conventional treatments such as chemotherapy or targeted therapy, or maybe before and after the radiotherapy has been done. So I see that the patients, they have better quality of life, they have better expectancy of life, and better sustainability in terms of this toxicity from chemotherapy or other harsh methods. Basically, patients benefit from this more complex approach, not just dealing with one or another toxic treatment. And what might be still like a limitation, the oncolytic viruses are not that well probably researched yet. Yes, we have a lot to do in this field, and nowadays maybe we work more with rare type of localizations, not with the mainstream type of cancers such as breast cancer or colorectal cancer, because with these major type of cancers we already have a lot of options in terms of conventional treatment, and this is where the oncolytic viruses yet don't get into the treatment. Yes, if we get some of the most common cancer types as patients, then they typically will be end stage or very late stage patients already who have failed going through conventional type of treatment. And for sure virotherapy might be less potent. This is why we need more and more research to implement it earlier, yes, in earlier stages, maybe more in adjuvant setting or after the surgical intervention, and then in combination with other treatment modalities, and not to wait till this end stage, yes, when the immune function is already depleted and everything is reversed, other way around, and this is when oncolytic viruses cannot help that well. I'm excited that currently I see more and more ongoing clinical trials which are shaped to make research on combinations between oncolytic viruses and some forms of targeted medicine. I definitely feel there will be a lot of encouragement for the future, and there will be good results that will testify this modality that we need to go for the combinations of oncolytic viruses and other systemic treatment approaches. So this is a way to go.